Good afternoon, everyone. I am Nguyễn Văn Tú from Hanoi Medical University and Bạch Radiology Center. Today, I would like to present my study called Efficacy of Cutaneous Vertebroblasty in the Treatment of Vertebral Compression Fractures with Intravertebral Clefts. Vertebral compression fracture with IVC is not uncommon. Causes spinal instability did not respond to conservative therapies. Surgical intervention is recommended with percutaneous vertebroblasty. The pathogenesis has two mechanisms with traumatic and non-traumatic. The initial trauma causes a small trabecular fracture with an impaired healing process due to failure of reparative process predisposes to ischemic necrosis and may result in collapse with progressive collapse, putting the arterial supply at further risk in the visual cycle. The two main patterns of collapse, pattern 1, collapse connected with intervertebral space, pattern 2, IVC traverse to anterior edge of the vertebral. Most cases of this pattern are very dynamic unstable. Over one-third of patients will experience chronic pain associated with osteoporosis vertebral compression fractures. Appearance of intravertebral is common in these patients and has received much attention in recent reports. The purpose of this study was to clarify the clinical and radiographic results of PVP in the treatment of compression fracture with IVC and confirm the safety of PVP for treating of compression fracture with IVC and without IVC. 82 patients in my study in their IVC site was observed in 44 patients. Patients with compression with IVC who underwent PVP at our institution were included in this study. They comprise 36 women and 8 men with an average of 74 years. According to Janan classification of vertebral fracture, mid-fracture is most common with 61% of patients. Vertebral compression fracture with IVC were detected from T7 to L5, and they occur most frequently at the thoracolumbar junction. In my report, characteristic X-ray and MRI show a collection of intravertebral fluid or the presence of conjunction with air. Type T and type S is the most common type of vertebral compression fracture. My patient, 82 years old, with an L3 compression fracture on picture MRI of typical IVC site and upper end plate disruption. Hyperintensity is seen on this fast breast T2. Preoperative plane X-ray showing L3 compression fracture with an air cleft. Female patient, 70 years old with an T12 compression fracture. On X-ray and CT, IVC was a linear focus of intervertebral gas attenuation. On MRI, IVC was a sign of void on T2 and T1, which is characteristic of gas, was also considered an IVC. Average semen volume of the patients was for male. Vertebral height increased significantly after intervention, approximately 9 millimeters. Semen leakage was observed in 6 of 44 patients. Small amounts of semen leakage occur in the epidural space, perivertebral soft tissue, and intervertebral disc space. Female patient with T12 compression fracture with air and fluid collection in the vertebral body on MRI. Needle puncture through a pedicle. Comparison of the vertebral height before and after the produced negative pressure image in the defect when the needle is removing more airflow into the defect. And this is a leak of semen in segmental vein. Highly effective in filling the cavity with semen in addition to creating pressure to increase the height of vertebral compression. The mean VAS score are ODI decreased significantly following the initial surgery in both IVC and non-IVC groups. No significant difference in age, sex, VAS score, ODI were observed between IVC and non-IVC group. The mean VAS score decreased significantly following the initial surgery. No significant difference of high body vertebral were observed between IVC and non-IVC groups. The current study identified PVP as an effective and a safe intervention in the treatment of compression fracture with IVC. IVC occurs in osteoporosis patient, many women, vertebral body gas or fluid, access on X-ray, CT, MRI, and dynamic X-ray. IVC most frequently at the thoracolumbar junction and many gas. Good pain relief, vertebral body high restoration, and systemic complication due to cement leakage. Not statistically significant difference of high body, ODI, and VAS score of IVC and non-IVC patient. There were favorable outcomes and no neurological or systemic complication due to cement leakage. Based on our results, we believe that PVP could be an alternative method for the treatment of compression fracture with IVC. Thank you for your attention.
Thank you very much. Interesting topic. Yes, sometimes we see the IVC and then the cleft filled with cement very well on DSA we've seen. And the pain will relieve very well. But I think in this case, it's something like we put the balloons in and we inflate the balloon and then we inject the cement in. So what do you think? Is that similar or not similar to the balloon vertebroplasty? Have you done any ballooning?
We usually use percutaneous vertebroplasty in a Beckman Radiology Center, and sometimes no use percutaneous kyphoplasty in Beckman Radiology Center.
Yep. Okay, the same to me. I haven't done any kypho, but in my hospital, a lot of neurosurgeons they created the cleft themselves using the balloon, and then they fill with cement, and of course they said the patient have a good recovery. But I just want to ask whether you already have any kypho, but you are not, so that's the same. I think it's quite similar. But in this case, I think when the patient have the cleft, that means it's not very acute. It's somewhat like subacute or maybe chronic. So I think, do you have any different in pain score in the group of IVC and non-IVC initially? So at first, you assess the pain. So you have any different the pain score between the two groups, IVC and non-IVC?
This slide shows a significant difference in VAS score and ODI we observed between IVC and non-IVC group. This is a VAS score and ODI in IVC and non-IVC group at a before produce.
Before procedure. Not much different. So I think the IVC even is not a very acute pathology, but the pain score is not significantly different in comparison with the non-IVC. Okay, thank you very much.